This story is about Charlotte. She's an 18-year-old girl with antisocial personality disorder. At the age of 15, she started showing symptoms of this disorder. 5 days ago, she was arrested for stealing a library book. Later, she was brought to the hospital for treatment. In this footage of Charlotte found at the library, you can see her prominent symptoms of this disorder. She also acts impulsively in a reckless manner and does not have the ability to plan out her actions. With antisocial personality disorder, she also lacks the responsibility for her finances, one of the main reasons why she did not pay the fines for her library books.
Hey there, how are you?
Hello, how are you? Can I check out this book?
Sure, let's. What's your last name?
Smith.
Here's the last cup back there.
Which Smith would you like to be?
Charlotte.
Charlotte? Okay. There's a whole list. Charlotte, you have 6 overdue books, as well as 3 books from middle school checked out. Can you look for them and bring them in before I let you borrow this one?
Okay, no worries. I'll come back tomorrow with money to pay the fines.
Okay.
Can I sit over there and read this book?
Sure.
Okay. Thank you.
Just bring it back into the drop box when you're done, okay?
Okay.
Don't forget your books, okay?
Charlotte is taken to the hospital. She will be treated using cognitive therapy. This helps focus on the patient's understanding of their own problems, recognizing that she needs to change her mental set and understand how others view her and the world around her. This is also known as client-centered therapy.
Come in. Hi.
Why am I here? I don't have this disorder.
It's okay. We'll talk it through. So, at the library, what happened in your point of view?
Okay, I was there to check out a book because I wanted to read. I went up to the counter and I gave her my book, and she won't let me check out my book because I have fines to pay. Like, this is all her fault. Like, this would never happen. She just let me check out the book in the first place. I would never do anything wrong.
Well, I completely understand your point of view, but is it really the librarian's fault?
It was her fault.
Okay. Well, let's think this through. So, what's the librarian's job?
They're there to check out books and then help me and assist me and make me happy. What good are they if they don't do that?
So, they're there to help people, but they also have rules they need to follow or they'll be fired. So, the librarian can't check out your book if you have fines. And who is responsible for paying the fines?
I was.
So, you can enable a librarian to help you if you paid your fines. Okay, well, let's talk about your past a little bit. I see you have a long history of crimes, and this isn't the first time you've stolen a library book?
Nope.
Well, this behavior is very inappropriate. So it hurts people. You should not be doing stealing and stuff like that.
Does it look like I care?
Well, okay. Let's talk about your childhood now. So I see that you have multiple fractures as a kid. You have a fracture on your left radius, left humerus, right tibia, and along with 4 fractured ribs. How did this happen?
I fell down a lot when I was a kid. I couldn't gain control of my feet.
Well, I guess that's good for today. I'll see you tomorrow.
Okay, bye.
During this therapy session, Charlotte exhibited several of the symptoms of antisocial personality disorder. She displayed an aggressive and irritable behavior towards Dr. B. Charlotte did not take responsibility for her own behaviors, one of the many symptoms of the disorder. Instead, she blamed it on others, such as the scapegoat theory. She showed a lack of empathy and guilt for her crimes and did not care about who it might affect and how. Charlotte also lacked the ability to learn from her mistakes, given by the fact that she has committed the same crime over and over again. She has a big ego, as evidenced by her belief that she is the most important person in the room and she feels that everyone is there to make her happy and fill her commands. Charlotte had a tendency of lying and attempts to deceive those around her. One of the possible reasons for antisocial personality disorder was the constant abuse she faced from her parents as a child growing up. Today is the second day of Charlotte's treatment. Dr. V has officially diagnosed her with antisocial personality disorder. Today, she will be giving Charlotte drug therapy to help with the disorder. This includes giving her lithium to help with the bipolar side effects of her antisocial personality disorder.
Come in. Hi Charlotte, how are you today?
Fine.
So today we're going to try something a little bit different. I'm going to give you some diagnosis and treatment options, and I would like you to really consider them. Is that okay with you?
Whatever.
Okay. So I've noticed that you've possibly been abused as a child. Is this true?
Yeah, I guess.
Okay. Well, I feel like this is contributing to your antisocial personality disorder, which I'm diagnosing you with, and it's because you are manipulating, and I feel like this is due to your abusive past. So I'm going to prescribe you some lithium, and this is going to help you with suppressing these impulsive behaviors and really helping you get along with society. It'll only help you, and I'm just trying to do my best to help you.
Well, I'm just trying to let you know that these behaviors aren't my fault. Other people are doing this to me.
Okay, well please consider this, and please take this medicine because it will really help you and make you feel better. Thank you.
Yeah, think about it.
Charlotte has exhibited more signs of antisocial personality disorder than when she first walked into the hospital. She is now acknowledging her symptoms. Most people with this disorder lack the ability to realize they have a problem, such as in Charlotte's case. They are usually brought in by friends, family, or law enforcement. Dr. V was correct in diagnosing antisocial personality disorder, and she used cognitive therapy along with drug therapy to help alleviate Charlotte's symptoms. Although there is no true cure for the disorder, many of the symptoms can be relieved, as such in Charlotte's case. This can help her live a relatively normal life from here on forth. The symptoms of antisocial personality disorder tend to decrease as an individual ages over time. Dr. V uses the symptoms for antisocial personality disorder located in Axis 2 of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, to help diagnose Charlotte in this case.